Thank you, Mr Deputy Speaker. I declare my interest and my family's interest in healthcare service. I welcome this bill. And those concerned about this should realise that this bill is an evolution, not a revolution, coming from the ground up. And don't take my word from it. Take it from the Evidence and Health Select Committee, where, I quote, Simon Stevens said, "We've been working so closely for a number of years with our colleagues across health services and our broader partners. So genuinely, I think this is unusual, if not unique, in terms of having come from the NHS as a series of asks to Parliament rather than something Parliament is imposing on the NHS. That's the leader of the NHS. Now, 3 minutes is a very little amount of time to try and pull this bill apart. So I'm going to use my moments to try and ask for some amendments and some new ideas I'd like the Minister to consider. Some are practical, some are short, and some are much bigger. The first is a simple one: annual virus drills for care homes. We have fire drills regularly, but care homes, given the pandemic, may well benefit for being future prepared for further pandemics. I'd like to see mental well-being as a public health issue. Everyone suffers with mental well-being. Not everyone has mental health, and this House often gets confused between the two. And that's really important because until we label it as such, it becomes very hard to implement education and protective policies. Many of you will know across this House that my particular interest is body image, the labelling of altered images. And just like we label calories on food, a parity can be made between physical health and mental health. And finally, and probably the most revolutionary piece I'd like to put across, is to have a named person for change on the front line. We have named whistleblowers. We have protected people who are guardians for data. But fundamentally, change has to come from the bottom. And all too often in my career, I was told, "You're too junior," or "This is the way we've always done it." And we want to empower the people at the front line who understand how the system works to be able to make those changes. And I think there is a chance to put an amendment to be able to do exactly that. And I'm happy to meet with the Minister to explain further. Now, as I've got a little bit more time, I'm keen to point on the reduction of bureaucracy. And it's very well making sure that when we're commissioning, there's a problem. But fundamentally, we need to look at the admin on the health service side, the barriers between primary care and secondary care, because about 5 to 10% of a GP's workload is dealing with chasing admin. This is not time well spent. It takes services away from the clinical front line, and something that could be remedied, possibly even without legislation. Thank you.